Hello, what should you do prior to colonoscopy procedure if you are taking platinum medication, such as warfarin, Eliquis, Xarelto, or Badaxa? For warfarin, you should recheck your INR about 2 weeks prior to the procedure. If the INR is therapeutic, then you should hold your warfarin for 4 to 5 days prior to the procedure. You may need to be bridged with the Lovenox injection if needed. If you have recurrent blood clot history or recurrent stroke history or any strong risk factor indicating you have high risk of blood clot or stroke when you off warfarin more than 3 days, then need to be bridged with the Lovenox injection off warfarin for more than 3 days. If you have a very elevated INR, like critical INR, then you need to hold your warfarin and reduce the dose of warfarin to get to the therapeutic before you can plan for the procedure. If your INR is slightly high, then you need to adjust the dose and recheck in 1 week if needed, or should adjust the dose and plan to hold for 5 days or so for the procedure. If you have to use the Lovenox injection for bridging, then you should follow your doctor who manage your warfarin for the anticoagulant. Make sure you understand when to start the Lovenox injection and when to stop before the procedure, when to resume the Lovenox after the procedure. If you are taking Eliquis, Xarelto, or Badaxa, you probably need to check your if not within 3 months. Your Eliquis, Xarelto, Badaxa may need to be held for 2 days prior to colonoscopy procedure. If you have a normal kidney function, if you have a kidney disease or your kidney function is not normal, like your serum creatinine not within normal limit, then you may need to hold your warfarin. Excuse me. Then you need to hold your Eliquis, Xarelto, or Badaxa more than 2 days. When you need to hold your Eliquis, Xarelto, or Badaxa more than 2 days because of your kidney function issues, then you may need to delay to resume this medication. So typically, you resume Eliquis, Xarelto, or Badaxa 1 day after the procedure. But if you have kidney problems, then you may need to resume your Eliquis Geroto Obedaxa 2 days or more. So you need to follow your doctor who manage your warfarin or your anticoagulant and your surgeon or proceduralist. You don't have to reach when you hope for your Eliquis Geroto Obedaxa. You should check with the surgeon or proceduralist to make sure when it's safe to resume your blood thinner medication. If your surgeon or proceduralist recommend to delay to resume your blood thinner medication, you should report that to your doctor who managed your blood thinner medication or your anticoagulant so they can update the recommendation in the systems. If you have any question, concern, please let me know in the comment below. Cardioversion. What to do prior to cardioversion procedure if you are taking blood thinner medication such as warfarin, Eliquis, Geroto, or Bedaxa. Typically, you must be on blood thinner medication before they can do the cardioversion procedure. And do not hold your blood thinner medication prior and after cardioversion. You must test your, if you're taking warfarin, you must test your INR weekly. You must test your INR weekly for 3 to 4 weeks prior to the procedure. And then test your INR weekly for 3 to 4 weeks post procedure. Your INR weekly must be therapeutic or in range before